volume ventilation being used, and your tidal volume is too high or too low. If that's the case, you just simply need to come up or down with that on your patients. Again, it may be a case of you're trying to blow off some CO2 on your patient when they first came in, and now they're more compliant and blowing things off better, and you don't need that necessarily high or low of a tidal volume as you did when the patient first came in. And so just adjusting those can really help fix that inverse IE ratio. If none of those seems to be the problem, then the next thing to do is call your respiratory therapist to the bedside and figure out a problem together. Our next alarm is the apnea alarm. Some of the most common things that can trigger the apnea alarm is your patient being over-sedated. We talked about in spontaneous modes, if your patient's expected to take their own breath and they're sedated and they can't, you're going to have an apnea alarm. Is the patient disconnected? Like I said, I work in peds, and those little kids know how to pull their vents right apart all the time just to get somebody to come in the room and pay attention to them. So that's usually one of the first pediatrics, is that the tube is disconnected. And then the patency of your tube, as we talked about earlier. Is there a crack in the line? Is something open? Did somebody give a knob and not close it up before? Did one of the tubes just pop off and not working the way it's supposed to be? Those are all things we need to check with the patient. Going on to what do I do now with the apnea alarm? Again, always check your patient first. Is the patient actually apneic? If they're not, if they're just maybe taking too short of breath and the machine is thinking that they're apneic, then you need to apply appropriate ventilation support for that patient or manually ventilate their patient not able to take their breaths on their own. Can the ventilator sense the patient effort? Sometimes if the sensitivity on the ventilator is too low, the patient is trying to take a breath, but the machine is not sensing that the patient is trying to take that breath, and the patient's not getting the adequate support that they need.